Hi, my name is Becca. I'm a pelvic floor physical therapist, and the purpose of this video today is to discuss various issues involving the prostate gland. If you're having prostate issues, chances are you've either gone to your primary care physician or you've gone to a urologist, and that practitioner has ordered a test called the prostate-specific antigen test. Basically, your doctor wants to get a baseline of this number. They're going to track it over time, and if your physician sees a dramatic increase in this PSA level, there's a concern that something is happening in your prostate. This is often followed by a biopsy of your prostate gland to see if there are cancerous cells within it. If there's no cancerous cells in the biopsy, congratulations, you do not have prostate cancer. If there are cancer cells within the prostate, then there are two treatments that we will discuss today that are utilized to treat for prostate cancer. The first would be removal of the prostate gland, also known as a prostatectomy. Surgeon goes in and removes that entire feature of the pelvic floor. The second treatment for prostate cancer would be either radiation therapy in the form of seeds that are implanted around the prostate or in the form of beams that would destroy the cancer cells in this region. So what we're going to talk about next is the anatomy of the prostate, what lies around it, and what symptoms might be found with prostate issues that can be addressed. So in order to better understand the prostate, it helps to look at a model and see physiologically where it is exactly within the body. So this would be a cross-section of the male pelvis. This is the prostate gland right here. Right up along on top of it is the bladder. This is the bladder neck. And along the back is the rectum. So if there is an elevated PSA level in the blood, and there's the absence of cancerous cells in a biopsy, that may be a sign of benign prostatic hypertrophy, which is basically an overgrowth of cells within the prostate gland itself. This usually happens to males over the age of 50. There are several treatments available, but one of the signs and symptoms is urinary dribbling, urinary urgency, and nighttime urination. Why? Because this prostate is pushing up against the wall of the bladder. In the second scenario, where the male does have cancerous cells within his prostate, and the doctor opts for a surgical removal of the gland, what is often a side effect is urinary leakage and incontinence, but also sexual dysfunction, in part because the prostate plays a role in producing the seminal fluid for ejaculation, but also because of the scarring incurred because of the cutting the physician must do around this area. So in a case of the prostate removal, a man may achieve enough rigidity for manual sex, but maybe not for penetrative sex. Either way, there's treatments for that as well. Finally, in the third case, where cancerous cells are detected in the prostate, a doctor may choose to implant seeds of radiation in this region or direct an external beam to destroy the cancer cells of the prostate. In this type of surgery, what is common thereafter is pain with urination, but also there are more bowel issues associated with radiation because we're singeing these very delicate tissues along the rectal wall in order to destroy the cancer cells. Studies have shown that coming for pelvic floor physical therapy before or after a prostatectomy or prostate removal can greatly improve urinary continence and sexual satisfaction. Also, if you are diagnosed with benign prostatic hypertrophy, which is enlargement of the prostate with no cancer cells, you can also benefit from pelvic floor physical therapy to strengthen the muscles that are holding up all of these organs in question. Even if you had a prostatectomy 10 years ago, you can still benefit from pelvic floor physical therapy. So go to your urologist or primary care physician and request a referral for pelvic floor physical therapy to address your prostate needs.